Okay, I'm going to call to order this meeting of the Assembly Public Health and Safety Committee. It is October 2nd at 11 a.m. Let's start by calling roll, please.
Mark Littlefield.
Karen Bronga.
Anna Brawley.
Cameron Perez-Radia. And also joining us. Okay, and up we have
Kimberly Rash, Acting Director, Anchorage Health Department.
wonderful. As usual, if those on the phone, why don't we go around and make sure you guys are here. Mr. Rivera.
Present.
Mr. Martinez.
Present.
Mr. Volland.
Here.
Mr. Constant.
Here.
Mr. Johnson.
Here.
Mr. Salt.
Here.
Okay. It's like everyone's here. Thanks for being here today. As normal, if you have questions and would like to get in the queue, if you could just send me a text. And we will begin. We do have a really full agenda, and so we're gonna do our best to keep things moving along. I know there's a lot of content today, but we want to make sure we have time for questions. And I am hoping to make sure there's time at the end for some audience participation. So let's jump right in. Kim, would you like to get us started?
Yes, perfect. Thank you so much. So the update that I'm going to give today is in regards to our community health nursing program within the Anchorage Health Department. So at the next assembly meeting on 10/8, there will be a appropriation coming forth to the body, which is our annual appropriation of funds from the State of Alaska Department of Health. It is our public health nursing grant that we receive. And with that, it runs on our fiscal basis, which is July 1st through June 30th of every year. And really, it's just bringing awareness to what the clinic does. So within the clinic, we have 3 sections. We have our immunizations, we have our disease prevention control, and then we also have our sexual health clinic. And so we have those 3 main sections within our public health clinic. And really what we do is we have nurses, they provide immunizations, they have active and passive community disease surveillance, family planning, and building partnerships with community organizations. Within our sexual health clinic, I just wanted to give some statistics. From national data released by the Center for Disease and Control and Prevention, in 2022, Alaska ranked among the top states in the country for sexually transmitted diseases. In 2022, Alaska was ranked the 3rd highest for chlamydia, 4th for gonorrhea, 16th for primary and secondary contagious syphilis, and 13th for congenital syphilis. Many STIs show no symptoms, and teenagers alone account for 3 million STI cases a year. So 1 in 4 will get an STI before the age of 24. Within our immunization section, some people may or may not know that we do more than just COVID and flu vaccinations. We provide vaccinations for infants and children ages 0 to 10 years of age. Getting your child vaccinated on time will help protect him or her against 18 vaccine preventable diseases. Also within the clinic, we have our TB side that we also treat and case manage clients with active tuberculosis. So in the month of August, we had 12 clients that had active TB. We performed 74 IGRA tests, and that's the blood test, and we performed 1 skin test. One of the new and exciting things that we are doing within the clinic, we are still working very hard on increasing staffing. We do know that it is hard and still continues to be hard to recruit for nurses. However, we are and have created an outreach team of nurses. And this outreach team is really creating a plan and how to get into communities, those that are underserved, and really provide education on our services, provide testing and treatment, not only for some of the items that I just brought forth, but really just looking at family planning as well. And so this outreach team in the month of August conducted 14 outreach events. That is an all-time high since the pandemic. And so that team is really getting out there, really providing the education, and getting to know the population that we're serving. And so we're really excited about this team. As again, in the past, we haven't had a lot of nurses. And so it's just really exciting to see that as we continue to build capacity, we're able to do different things within the community. And I know that was really quick and dirty, but again, it's just bringing awareness to what the clinic does and that we are receiving our annual amount of funds. It's a little over $3.2 million that we receive, and most of that goes for labor costs.
I don't see any questions. I do just have one question. Can you just give us a sense of the staffing of that 3.2 million? What is the staffing of the community health and nursing?
Yeah, so staffing when we are completely filled is about 50 individuals, which includes everything from CMO all the way down to our office associates. At this time, I believe we have 18 or 20 vacancies currently. It goes between advanced nurse practitioners, nurses. We have a few medical assistant positions vacant. We did just fill up our office associate positions.
Thanks. And I have a question for Ms. Brawley.
Yeah, thanks. Related to that, I know in the past, there's been kind of limited hours at the clinic, and I think due to staffing. So I just wonder what the status of that is. And then also, I know in the past, there's been a big differential between private sector nurses and these positions in terms of pay. So kind of, can you just share if there's been changes there? Because I honestly can't remember at this point. Thanks.
Yeah, great question. And so in regards to hours, we are open Monday through Friday, 8 to 5. We do close the clinic Thursday mornings, and we don't open the clinic until 1. That is the time for all of the clinic staff to meet, to receive training, to have their just weekly division meetings. But other than that, we are fully open, ready to receive clients. Sometimes due to if an individual is out sick, if a nurse is out sick, we do have to shuffle around the schedule. And sometimes we're not able to see patients same day, so we do schedule those out. At this point, we are not scheduling out patients very far into the future. I would say less than 2 weeks at this point. Which seems to be on average. In regards to pay for nurses, that still is, I wouldn't say an issue per se, but it's still a concern. The nurses' pay within the clinic is not as competitive as hospitals. So that is one of the struggles I think that leads to our ability to recruit and get people in the door.
Thanks. Thanks very much. No
right.
other questions. And thanks for being
Thank
here. Chief Case. Next up is Anchorage Police Department. And just in addition to the agenda, we're going to do an MIT update, but also just do some general updates as well. So welcome. Thank you for being here.
Thank you. Before I get started with the PowerPoint slide, Mr. Chair, I just want to give you a quick update on the August 13 officer-involved shooting, as we released the video earlier today. And so we are in day 3 of the 45-day process for the administrative investigation. So we've got about 42 days left of that investigative time, which we have outside individual that will be conducting that investigation. And then after that investigation is complete, they have another 45 days to compile their findings. So it's a 90-day turnaround process by contract.
Great. Good.
All right. I want to talk about MIT to start off. One of my favorite subjects. That's a busy slide. I'm going to start on the top row with the numbers. When calls come into dispatch, and I'll kind of orient everyone that when we first started MIT, there was some desire to have calls categorized as the way it is being done in Fairbanks. And that's a little bit challenging to do here in Anchorage because the call volume is just so extensively high. So we've had to modify that throughout the time. When calls come into dispatch, in this period of time that we're looking at on the slide is January 2023 to August 2024. We're looking at 185,000, almost 186,000 total calls. 12.7% of those are suspected or identified mental health calls when they come into dispatch center. Of those calls, 40% of them are just straight police related problems. In other words, we're responding for a crime problem, and the mental health issue is secondary. All important nonetheless, but it's a secondary issue at the time. If you look at the first green box that has the number 5,021 or 21.4%, those are the calls that come in that are mental health related, where there's no safety concern. Some of those are handled by our mobile intervention team. Some of those are handled by the fire department's MCT team, and some of those are transferred to the care line. And specifically, 46.6% of those calls are transferred over and handled by the MCT team. And I think that's important to focus on, particularly when you look at that our MIT team only handles 11% of them. So when we're involved in the conversation of the benefit of having both an MCT and an MIT team, that data point where the majority of those calls are being transferred to MCT is kind of where we're getting the bang for the buck, if you will. And there's reasons why we're not transferring more. Sometimes it's because the MCT team doesn't have the capacity; they're on a call, and that's one of the primary reasons. Is just I think we're all in the same boat. We could use more clinician teams out there because the call volume is just that high. Any questions about that slide?
Yeah, Ms. Brawley?
Thanks. Can you unpack the top right green box that says mental health safety concern versus no safety concern? Like what, obviously, there's a wide variety of safety concerns. So what does that actually mean?
Yeah, so when we look at sending calls either to MCT from dispatch or our CARES line, we're talking about the no safety concerns. And that 8,970 calls there's some safety concern that comes into dispatch center. And the challenge is that those safety concerns can be real or just kind of assumed by all parties involved. And so that's the real challenging part, that we have to have officers that respond on the scene for them to determine. And then in most situations, the officers end up handling the call because now they're there and they can do it. So the more that we can, in fact, I'll talk about how much we've improved our ability to screen calls on dispatch here in a couple slides, so that we can ensure we send either MCT or MIT on a call and reduce the likelihood that we have to send officers to the call to make that determination themselves.
Yeah, just a quick follow-up. So I guess my more pointed question is the presence of a weapon what determines a safety concern or not? Or
No.
reported? Okay.
No.
Thanks.
There's a whole host of things that make it safety concerned. There can be a lot of yelling and hollering and kind of a caller that's frantic that would indicate we don't know what's happening there. And just that alone is something that we probably don't want to send. That's an unknown problem that's causing that level of excitement, if you will. And so sending in like an MCT team before officers go in would probably not be the best environment for them until it's determined what it is.
Just one more clarification on that. The two green boxes are if there is an identified mental health concern.
Yes.
And so many calls, there is not a mental health concern. And so a mental health person would not be on that call. Is that right?
Correct.
Okay.
Yeah.
Thanks.
The majority of the calls that come into dispatch center, when it's at the point of dispatch, 87.3% to be exact, are no known mental health issue when we get the call into dispatch.
And I have a question from Mr. Constant.
Thanks. Hi, Chief. So imagine a scenario where MCT shows up because that's what's been determined at dispatch, but things go south real quick. What's the methodology for the fire department to connect with APD?
Mr. Constant, that is through dispatch. So it'll, to create a mental picture of what it looks like, AFD personnel will let their dispatch center know that they need officers. AFD dispatch will contact APD dispatch. APD dispatch will contact officers, and then officers will respond to the scene.
Okay, well, I won't dig into that too much there, but I think you probably know where my mind is at.
Absolutely.
Okay.
So this is that dispatch slide I was talking about, and the green number of 93.2% is the increased rate at which our dispatch center is able to identify at time of call prior to officer arrival that this in fact is a mental health related call versus backing up prior to January of 2023, where we were just utilizing officers for everything and they were determining what this call was. So there's a whole host of reasons why this has happened, but MIT is obviously the biggest influence, and educating dispatch as well as educating our officers. So even when our officers are en route, so they're dispatched to the call and they're getting updates, the officers are still having the ability and the training now today to be able to determine that it's more suited to be either an MIT or an MCT call versus them having to go and respond at the time. So a pretty significant increase in our ability to start diverting resources prior to officers arriving on scene.
Just a clarifying question on the graph, the number in the blue boxes is the number of calls,
Correct.
and then the arrow shows the relationship between what is the white arrow? How can you understand what the white arrow is showing?
So that arrow is that 93.2%. So it's averaged across the time frame from January 23 to August of 2024.
See, okay. Yes, Ms. Brawley.
Just a very quick comment. I am glad that we defended the funding for this program because it is clearly working. Thanks.
This is also a pretty impressive slide. This is, again, a significant impact on not only having clinicians in the field, but the formal and informal training that takes place. And what this slide represents, particularly that 42.9%, is the number of hospitalizations or Title 47s, to speak in code term, statute. How many folks are the decrease in utilizing hospitalization for those in mental health crisis. And that roughly 43%, that can be equated to dollars, which I'm sure some of the assembly members would know what that dollar is. These calls traditionally take approximately 3 hours of officer time from the time that they pick someone up and wait to get them admitted into the emergency room. So that's obviously a cost savings. Obviously, there's an implication on the time and money and resources in our medical emergency system and tying up bed space. So it decreases that. And it also has an implication on the impact on the people that we're having contact with, that we're transporting, or the client that we have. Keeping people in place allows them to have a positive impact on their job, transportation, and when they have to go to the hospital and potentially be placed on a hold to determine the threat level to themselves, that has long-term implications on themselves, and particularly job and what happens when they can't go to work for the next couple of days. So the ability for not only our MIT teams, but our officers to recognize there's other diversionary techniques that can be used so that they can stay at home or in place, not hospitalized, just allows them to be more high functioning than when you have to pull them out and place them hospitalized.
This is a little bit off the specific slide, but one of the things I'd like to dig into at some point is the determination if it's a mental health call, and the difference between somebody who is very upset, and needs someone to be able to sort of be there to work them through that versus a bona fide sort of like mental health crisis of some kind. Can you just speak to that briefly? We can, I think, dig into it at a different time, but and I know you're not a mental health clinician, but I would curious about that in terms of, I would imagine that many calls you're having people who are emotionally distraught, very upset, these kinds of things. Would those qualify as a mental health call? How is that determination made?
So we're using a much broader application of the word mental health crisis. it used to be that we still have a box on our police reports where officers would check that box if there was a known mental health issue that was related to the call. That data is obviously very unreliable. Currently, how we're looking at the data is we pull all the information we have access to, and we have someone that actually reads every single one of these police reports. And the reason why we broaden that definition to include your first kind of description, we would count that as a mental health call. Because the idea here and the objective is how many mental health clinicians do we actually need on the police department so that we can impact those calls as well as what people typically think is a mental health crisis. Because if we really want to try to divert some of these higher risk calls or calls that are more risky than what MCT is designed to go into, we have to be able to have the resources to address those lower level so that it's not a police resource or a police solution. And having MIT allows us to have the capacity to have non-police solutions to something that comes into dispatch as a police problem.
Yep, good.
The last metric on MIT is kind of just numbers, what we're looking like.
Yep, sorry, I didn't see you. Mr. Collins, you have a question? Go ahead.
Yeah, just to follow on to your question, what training are we providing then to line officers in recognition of mental health crisis? So not the specialized teams, but everybody, so that they're prepared to make a data-informed decision.
So everyone in our academy has 2 days of training. We're increasing that training by, I believe, 10 hours for the December academy. Mental health communication will be the title of the class, because communication piece is pretty significant in determining how we can assist folks that are in crisis. So we'll be adding to that training. We also have in-service training that we put out. We have our CIT 40-hour course that we run once a year that the department not only does with APD employees, but from people around the state, to include probation and troopers and other law enforcement agencies come into that training. And then we also do our briefing or fallout training that before officers hit the street. That's where our mental health clinicians have probably had the most formal training impact, where they will provide training to officers in the field. One of the things that MIT has brought online also for that decision-making process is the Columbia Suicide Severity Rating Scale, which before it was just officers trying to apply the statute, Title 47 statute. Now we have more orderly questions. That's a validated instrument that officers can apply when making that decision. So they're more comfortable making the decisions, and they're asking the right questions and getting the right information. So that's been implemented in the field as well. That training was conducted during pre-shift briefing. So we have several different mechanisms to how we provide the training to officers, and we'll continue to provide the training.
Sounds good. Thank you.
Just a clarification, you said that previously there was 2 hours in the academy of mental health communication, and now it's 10 hours. Is it
2 days
two
for like a light version of what our CIT critical training is.
Okay.
We'll be adding another day essentially onto that, and most of it has to do with kind of recognition and crisis communication for those in mental health crisis, which is different from de-escalation. It's on top of that because it's a different form of communication.
And when you say mental health, are you including behavioral health issues as well, or is that separate?
Yes. That was a new element that was added this year to our CIT training. The kind of federal guidelines changed to add that into the training for the first time.
Thanks.
So these are the calls that MIT handled over.
I'm sorry. I have to jump in there and ask.
What's okay?
I am a practitioner in the behavioral health field, and I don't understand the difference between mental health and behavioral health. So can somebody help me understand?
I mean, I can answer from. I'm not an expert at all, but what I was referring to is when I think of behavioral health, I often sort of categorize that into sort of drugs and alcohol versus sort of a diagnosed mental health condition. But I'm not an expert at all.
Okay. Yeah. Thanks.
And Mr. Constant, one of the things that we added to this training this year also was like autism, response to autistic people that have autism, and those types that were not previously in our CIT training. So those were some of the expansion of the training that was added. And again, that was kind of a federal effort. I think we're probably one of 5 departments in the country that have added that already. It's brand new.
Hey, thanks. Yeah, and my understanding is like behavioral health is the umbrella term for almost everything that falls within the context. Under it, mental health services, there's addiction services, there's a lot of stuff. So thank you.
So MIT metrics, obviously a lot of calls for service that they respond to. I think it's important to note the nearly 1,800 calls that are post-crisis follow-up. This is where, again, we're getting into cost savings and we're getting into better long-term results. Officers obviously aren't doing any post-crisis follow-up in their day-to-day job as a patrol officer. They are having to recontact individuals only when it comes up to the level of a call for service. Our clinicians, on the other hand, based on calls that they've already had with clients, they're able to be preventative in nature, understand who the clients are, understand some of the triggers that they have and at what point they occur in their lives. And so they're able to have those post-crisis follow-up to try to prevent calls for service in the future. And obviously, if we're preventing calls for service, we're kind of lowering that level of crisis they're going to get into. And so it's certainly very, very helpful on a preventative term. If you look over on the right-hand side, this is probably the most important data point for me. In May, we started really looking at criminal diversion. And we've talked about it for a while, and how we apply it is always a challenge. Between May and August, we've done 46 criminal diversions. We're just getting started. And what that means is
Just need
instead,
to find that for us. Just
Yep.
so you know.
so that means I've talked a lot about there are some folks that have mental health related issues, or they have mental health crisis when we have contact with them. And, it used to be it's hospital or jail was a solution. MIT added a whole bunch of layers to that. And eventually where we wanted to go is we would divert them out of the criminal justice system if appropriate. And of course, I put an asterisk with if appropriate because everyone's going to know, when's it appropriate? Well, it's appropriate when the best solution to the underlying problem, which is the mental health condition, is somewhere other than jail or going to the hospital. And, the goal is that we will be having 100 of these criminal diversion instances every month, because I think that our preliminary data indicates that we potentially have that many. And this is certainly something that we've been communicating with the prosecutor's office and how that could be applied on a larger scale. But we have therapeutic courts, we have mental health courts, so we're using those already existing things currently, but we want to certainly expand how we use criminal diversion so that we can just be more efficient and effective when we respond to those in crisis. I got 2 slides left, so hang with me. I'll talk about Hope Team just for a second. This is relatively new. This is our homeless outreach team. And the thing that I really want to point out with them is in the first 45 days that they've been in existence, they've had more than 164 contacts, although their goal isn't to house folks, but they do play what I like to think about as connective tissue between the services that are in the municipality already. And so, the Coalition and Homelessness is obviously one of those partners where we can utilize the resources in camps and contacts with those experiencing homelessness, that there may be victimization, or there may be violence, or there may be threats. And so having an officer and a navigator there to go into those environments where maybe some of the nonprofits are not willing to do, that's where we're kind of filling that void with the Hope Team.
Just one note on that. This is all stuff we need to probably dig into more. Recently, Member Barali and I met with a number of residents from the Spenard area, and and had a lively and important conversation about their concerns, which was initially about homelessness. But the truth was, once we got through an hour and a half of conversation, it was all about criminal activity. That's where the concern was. And being able to sort of separate those a little bit to talk about the concerns that they were seeing in their neighborhoods was really about criminal activity that was happening in those camps and in those areas. And so I just wanted to put on the record that I'm really glad the Hope team's together. And I think that this is an area that we can really improve, because that's the overwhelming calls that I'm getting related to homelessness is not about folks that are camping. It's about drugs. It's about alcohol. It's about violence. It's about stealing those things, these kinds of things. And so is this team, do you feel like this team is really able to get into those camps and identify where that criminal activity is happening, and is better able to address it?
What we've seen immediately with the team is when we're addressing crimes that occur in homeless camps, we have to identify victims, we have to identify witnesses. Traditionally, victims and witnesses do not want to step out of their camp, report crimes or report victimization, and then go back into their camps where they were victimized or they witnessed the crimes, because that potentially can be unsafe. So what we've seen as an immediate impact is, as Hope team goes into these environments and have the ability to connect them to other resources, to include housing, we can identify victims and complainants, and then we can pull them out of the camp and provide them with housing if available. So that's the immediate impact, because now we have somebody that's identified themselves as a victim of crime or can point to crimes that are occurring in the camp.
Yeah, because that's what we heard time and again, is in many cases, it wasn't necessarily the people living in those camps, but it was they were vulnerable people. And so the criminal activity was surrounding them. So thanks.
All right, last slide. And I want to start by differentiating two different things. First, not shown on the slide is the UCR data, and Uniform Crime Report data. To refresh everyone's memory, is the data that's collected federally. We will be switching over to NIBRS, which is the new federal data that replaces the UCR.
Can you just repeat that again? It was UCR and now it's what?
It's going to NIBRS.
NIBRS?
Yeah, National Information Based Reporting System, I think is what it stands for. And so that's the federally mandated reports. And if you look at gun related violent crimes, we have year to date approximately a 20% decrease in Anchorage. Now, the crimes that make up the UCR violent gun related crimes are robbery and assault. Homicide's not one of those. So if you have a homicide involving a gun, it doesn't count in that data system. And again, I'll repeat because I don't have it up there. 20% decrease year to date in Anchorage on that UCR data. But you'll see on the slide there, I have a 15 to 20% increase in weapon offenses. We compile our own data that includes all weapon offenses to include shots fired. So we get a call that says, I heard shots down the street. Officers go, they pick up casings. We include that in our data. So I point that out just from the standpoint of, it would be really easy to report UCR data and I would be done talking by now. But we're really diving into the data and getting down to a real granular look at it, because we all have heard about shots being fired or shootings or a lot broader weapons, particularly gun-related crime in Anchorage, that's not reflected in the traditional data. And so we are looking at the data differently so that we can capture all the things that are happening with guns. So when we report the data, it's more reflective on what we're seeing, and it also helps us in how we're going to respond, because we specifically know what type of gun-related violence is happening in the field.
I have a couple of questions for you, but can you just, what's the takeaway from what you're saying? Can you just give us what's the point of this?
The takeaway is we are seeing an increase in weapons offenses throughout the city, and the way the police department is analyzing the data is on a much more granular level than what we did, say, a year ago. And so if we use UCR data, we would say, hey, we have a 20% decrease. We're done, right? Like, we're decreasing. But yeah, we still have the community that's saying, but wait a second, we're seeing some of these gun-related incidents or offenses, how come we're not seeing the police department recognize that? And the purpose of this slide is to show the way that we've changed the way we look at and analyze data. And our data is reflecting what we're hearing in the community. And because it's granular, we now can address all of that gun violence across the board to determine how we can impact that and continue to report to you. So in 2 or 3 months or 6 months, when I come back, that 15 to 20% number is important to you.
Gotcha. Okay. Ms. Brawley.
Yeah, thanks. I just happened to read an article recently about folks who have developed what's called a real-time, I was just looking it up, real-time crime index, basically speaking to the point that you, or the issue that you raised, which is that the federal reporting, comes out annually or it's not as available right in real time. So I can send this afterwards, but I wonder if there's an interest potentially, because I believe you just provide the data to this index, and then it can be available. I'm looking, no Alaska communities are participating, but there's several other states and communities. I was just looking at Ohio. So that might be an option to look into in the future, but I can share it because I don't know what the costs associated are. Thanks.
And I did have a member ask, is this slide deck on our website? Is it on the website? Okay. And then would you mind just sending it out to the members real quick? Thanks. And I have Mr. Martinez up next. George, did you have a question?
No, Chair, that was it. Thank you for communicating the request for the presentation.
Okay, thanks. Thanks. Okay. Anything else from you?
That's it.
Okay, and you might want to just hang for a second. I think what we'll do is we will, yeah, let's have the fire department come up next, and then we'll do the Department of Law. So you can, thanks. Thanks a lot. Welcome, Mr. Schrage. Welcome.
Thank you. Good morning. Well, I have a short, four topics to give a brief update on. I'm Doug Schrage, Chief of the Fire Department. The first item is I wanted to share with you that we have let a contract for a contractor to write our community wildfire protection plan. This is a key deliverable from our 4-year wildfire mitigation grant that we're working towards. This plan was last updated in 2007. We conducted a public procurement process. We had three proposers. We have met with the contractor, and there will be a formal kickoff meeting later this month. The Community Wildfire Protection Plan is a comprehensive area-wide management plan that will take 12 to 18 months to complete. It's a very big collaborative effort. It will involve input and collaboration from those of us in the Anchorage Fire Department, the Chugiak Fire Department, and the Girdwood Fire Department. And it will comport with the municipality's all hazards mitigation plan and the Alaska Forest Action Plan. So there will be a series, as part of this effort, the contractor will conduct a series of public meetings that you'll probably be interested in knowing about. The only other related thing here is that thankfully our wildfire manager begins next Monday. His name is John Glover. And so we'll be able to see better coordination, I think, out of that entire program.
Great. I have a question for Ms. Brawley.
Yeah, thank you. I have two different questions. First is on the plan. So we've had a lot of talk about, housing and where to build more housing, where there should be more development. And I know one of the challenges is a lot of the land that we have open is in places like Hillside, where it is also a higher fire risk. So I guess generally, I know you're just kicking off this process. Generally speaking, maybe the ask is to consider not just the way the built environment looks right now, but kind of looking at future development. So I don't know if you can comment if that's within the scope, because I know we can think about how to protect everything that's on the ground built today. But if we're looking out, 10 or 20 years, right, that might look differently. So I just wonder how that factors in, or what the general scope of this plan is. And then I have a totally separate question after that.
Sure. Yeah. Thank you for the comment and the question, Member Brawley. Judging by the 2007 plan, it did provide some future modeling based on anticipated growth. So I would expect that would be part of this plan. I'm not intimately familiar with what the outcome will be, but I would expect that to be part of it.
Thanks. Yeah, and I'll just mention, I know, looking back at the Hillside District Plan from 2010, it does have a fair amount of growth projected, but I think we've also seen a disproportionate more building in that area versus other areas. So just to be aware of kind of how that's changed since 2007. And then my separate question is more on operations. Not this plan, but wildfire protection, just the status on the MOA, or sorry, the state grant that the muni received that we had some conversation about back in August. And also just seeing, what's being wrapped up by the end of this season, maybe before the snow flies. And then is there a look to another legislative request for the coming years? Thanks.
Yes, thank you again for that question through the chair. I'm not really prepared to provide an update on what has been accomplished, but I do know that our team has been coordinating with the Halo group, and I know that some work has occurred, but I'm afraid I'm just not able to say what it is right now. So I'll put that on our agenda for the next month, and I'll be able to detail that.
Thanks. And again, just we're working on our legislative program. So of course, the mayor's office is working diligently on that too. But I think we should think about, making another legislative request, and then also thinking about not specifically wording it as Hillside only, because I know they're stuck, right? There's everyone along the Chugach. So maybe thinking about that more broadly in the future. Thanks.
Thank you.
Yeah, and just to tack onto that, I'm really interested in seeing some metrics in terms of how we are doing, and to be able to determine this wildlife season or wildfire season versus previous seasons. And as the manager comes on, and as this plan, I'm really curious to see how we're able to demonstrate how the investment we're making in this is making a difference. And I don't know if that's part of it is to be able to report out on that plan and to show progress or challenges or whatever.
Yes, thank you for the question. It's so much of it is dependent on weather. Like 2 years ago, we had a historic wildfire season, which we had many fires here in town, and this year we had very few. We had a lot of small fires that were easily contained that would not continue, wouldn't be considered a major problem. So it's going to fluctuate wildly. So the way you smooth that out is by averaging it over a 5-year period. So we could look at a rolling 5-year period or something like that. I'm certain that we have those data, and we could give a presentation on that.
Thanks.
Thank you.
Oh, yes, Ms. Bronca.
I don't know how to word this better than the homeless camps, the camps of people experiencing homelessness are a real fire hazard. I was by Russian Jacks yesterday, and someone was unloading an entire pickup load of wood for fires in their tents, and it's cold, and I understand that. But until we pull people out of the parks that are bringing in huge piles of propane tanks and wood, then anything else we do on a community plan is going to be worthless. This morning on the Chester Creek Trail, someone's burning a tire. Very lovely to go through that smell. So it's problematic, the open burning that's going on and being ignored. And I know that's not you ignoring it, but it is concerning to me.
I appreciate your comment. Okay, thank you. Moving on to my second item, which is an update on our fleet status. With all of the attention that's being focused on the fleet municipality-wide, I felt it would be appropriate to focus some attention here. It's important to note that the fire department's heavy apparatus fleet is not managed through fleet services, but within the municipality, we handle that internally. So they're funded usually through bond propositions put before the voters just for the fire service area or for area-wide EMS. But in the larger context of the status of our fleet, what we're finding is that our legacy replacement schedule, we have outgrown it as a result of the pandemic, which had increased the delivery time of a new piece of equipment from 14 months to 36 months. along with increased mileage and usage of our apparatus. Our call volume is up 12% this year already compared to the full year of 2023. And the fact that we are having staffing challenges in our vehicle shop, which is it's making it harder for us to keep the equipment operating. And so replacement schedule is being compressed and we're not keeping up. So this is something that I've been working with the municipal manager on and the OMB director, but it's something that you need to hear about. So 12 of our 19 engines, which includes 5 reserves, are all, as of today, beyond their programmed service life. 5 of those will be 5 of the engines will be replaced next fall with the ones that were purchased 3 years ago with the first tranche of SENT money. So those will show up in the fall of 2025. But even after then, we'll be 6 engines behind if we're going to stick to our current schedule. Of our ambulances, we have 18 ambulances across the municipality. 6 of them are presently beyond their current service life or program service life. And 4 of those will be retired. 4 of them are being built now, and they will be delivered next fall also. So all these things together are basically meaning that we need to replace our engines and ambulances at a faster pace than what we have been traditionally doing over the last decade or more. We currently have in process, just for your information, we have 2 brush engines that are expected to be delivered in March. Those were purchased with the wildfire mitigation money. We have 5 engines and 2 aerials that will be delivered next fall. Those are because of the SENT money that we got in 2022. And that we got in 2021, I believe, and then spent in 2022. And then we have 4 ambulances that will be delivered next fall. And then the light duty fleet, we've received a partial delivery of some of those vehicles, and the rest will show up in the next couple of months. Lastly, on top of the more rapid wear and reaching the mileage and the years of mileage and service on these vehicles, the costs need to be updated. So in our capital improvement program, we're seeing now that the cost to replace these equipment is higher than what we have been asking for in the last decade. So ambulances have increased from $350,000 to $375,000. Engines from $600,000, they've increased 100% in price. They're now $1.2 million for an engine. A new water tender increased from $600,000 to $1 million. And this is all the result of, I can't say that it's a result of the pandemic, but it followed the pandemic. And we think that's definitely a contributing factor. So I can pause there for questions before moving on to the next topic.
I don't see any questions, but I'm anticipating, based on comments from the mayor, that we're going to see the budget reflect the needs that the fleet has across the municipality. So I'm anticipating that this will in some way be addressed by the mayor's proposed budget.
Yes, thank you for the comment. The mayor has expressed that the fleet is one of the top priorities for this coming budget year.
Thanks.
Okay, item 3, just briefly, this is October. I think we all know by now that October is Fire Prevention Month. This year we are focusing attention on the importance of working smoke alarms. We've had 5 confirmed fire fatalities this year alone. A 6th one will likely be declared as soon as we collect all the information about it. The majority of the fire fatalities in Anchorage, practically all of them, are in places that do not have a working smoke alarm, which is astonishing. Consider what we know and how readily available these devices are. And in last year, we had 12 fire fatalities in residences, and my understanding is that none of those had a working smoke alarm in any of them. So this month, what we're going to do is our fire crews, along with fire prevention, are going to be identifying neighborhoods that are viewed to be at high risk, and we will be doing door-to-door smoke alarm campaigns and providing materials and providing smoke alarms to people that we think we need them. So I just wanted to bring that to your attention and let you know that this is a community public safety problem, and we're doing what we think we can do to address it.
Yes, Ms. Bronca and then Ms. Rowley.
Is there any data as to whether those are rentals or owner-owned places? Is this a landlord-tenant issue or with the smoke alarms or?
That's a great question. Thank you, Member Bronca, through the chair. I don't know off the top of my head. I believe we can, with that, it's a relatively small number of incidents, so it would be not difficult to determine that, but I don't know the answer at this moment.
Ms. Rowley and then Mr. Constant.
Thanks. Yeah, I actually had a similar question, but I'll just add a recommendation. To the extent that it is rentals, I would hope that landlords are required to have that in their buildings, but also it might be worth specifically reaching out to property management companies and kind of the major owners of rentals that we know, just to, again, make sure that they're aware of that. And if they have, maybe they need some resources there too. Thanks.
Mr. Constant.
Thank you, Chief. So I was going to ask this question on an unrelated topic, but it fits really well. So we started the conversation with you on the rural wildfire grant and how we're mitigating fire hazards up there. I have questions about urban fire hazards. In particular, it relates to deteriorating residential properties and the threat that they face. I think that it was kind of spoken about in your transition report. And so I'm wondering if there's any effort to capture and understand the scale and scope of the problem, and what efforts are being put in to help us understand so we can drive policy to mitigate the harms from poorly maintained and neglected multifamily residential housing.
Thank you for that question, Member Constant, through the chair. Those aren't data that we collect. The information I'm providing is mostly anecdotal to give some thought to better understand, to think about how we might be able to collect that or acquire that information. But I will get on that and see if we can come up with a plan.
Yeah, thanks. I just see it as a partner to the rural efforts. Our urban kind of deteriorating neighborhoods don't tend to have the same political power and clout, so investments aren't made in the same way. I would love to help do some work to understand the nature of the problem. I would be glad to help find funding.
Thank you, sir. I appreciate that, through the chair. Okay, and then just very quickly, in addition to this being Fire Prevention Month, we are also starting a AED public education campaign. AED is automatic external defibrillators. These are devices that any untrained person can operate to save the life of somebody who is in cardiac arrest, in conjunction with hands-only CPR. So we're participating in a national 1-month contest where people can help. What we want to do is create awareness about AEDs and ask our community members to help us populate our AED registry. We have 618 AEDs registered municipality-wide. These are both public and private AEDs, but we know there are many more of these devices. And the reason it's important to know them, their location, is so that when a Pulse Point user receives a cardiac arrest alert in their vicinity, the app will also inform them about the location of the nearest AED. In addition, our fire dispatchers can, by accessing the database, they can inform a 911 caller of where the AED is if there's one in their vicinity. And so what we're asking people to do is download the companion app to the Pulse Point Respond, which you're already familiar with. There's a companion app, which is the yellow one, which enables any user to just easily snap a photo of an AED, and your phone will know the location of where you're at. It will upload it, and we will be able to check to see if it's already in the registry or not. And if it isn't, we can add it. And so there's a press release that is expected to go out today. So we should be generating some public awareness of this, but I wanted you to hear it first. That concludes my report unless there are any general questions.
I don't see any questions. Thank you.
Okay, thank you.
Thank you, Chief. Okay, we're going to move on to the Department of Law, and particularly there's, you may have other updates, but the two pieces that I think that we really wanted to hear about are the first, the process, the progress in terms of the external evaluation of the one of the particular officer involved shootings. And then the second is the sort of external review of the police department as a whole in terms of their trainings and policies. So if you could give us updates on those two, and then anything else that you think is relevant. Thanks, and thanks for being here.
Thank you. So as members may recall, in the wake of the August 13th officer-involved shooting, the mayor and APD committed to two separate outside investigations. One is an investigation of the August 13th incident itself, and this is something that is typically done solely internally by APD through internal affairs. And in this, for the August 13th incident, this will be done by an outside investigator. And the second layer is an outside review of APD's policies, tactics, trainings, supervision as they relate to use of force and de-escalation. And that would be a broader review, and the outcome of that would be public report and recommendations. So I'm able to give updates on both. So for the first one,
Can I pause you just for a second? I just want to, members on the phone, I just wanted to give you a heads up. My phone is at 1%. And so I might ask Member Brawley if you'd be willing to, if you want to get in the queue, could I borrow your phone? Thanks. I just want to let folks know if you want to get in the queue, if you could please text Member Brawley, that would help. Thanks. Sorry for the interruption.
So for the first, the typically purely internal investigation, we have, as the chief mentioned in his update, on a 45-day timeline to complete that now. The Office of Special Prosecutions declined to prosecute the officer involved in that shooting on Monday. So that starts a 45-day clock under the collective bargaining agreement with APDEA to complete the internal investigation. So that we have the outside contractor in place. He is already in touch with APD, and he will be working, making use of IA staff at APD to conduct the investigation, but he will be present for all interviews. He'll be in charge of that, and he'll be coordinating. He'll be responsible for making the final report and conclusions, which will be provided to me. It will not be made public because it is an internal personnel disciplinary proceeding, but we are going to be as transparent as we can about the process of how that's happening.
I'm going to make sure I understand it, and I'll see if there's any questions. So the RFP process is completed. You've selected someone to do the review of the August 13th incident, and how does that person? So is there a review of it happening internal anyway, and this person is working with them, or this is a separate process that is happening that is led by the external investigator?
So first, it wasn't technically an RFP. We did use municipal procurement procedures, but given the time frame, an RFP was not feasible, so we used open market process.
But there was a request for folks to
Yes.
apply, and there was a decision made of who was chosen.
Yes, so we did solicit bids and selected the best one, and went through the municipal purchasing department, and contract is in place.
Okay.
And so this is not a separate investigation in addition to what normally happens with internal affairs. This is, I would say, a modification of the standard procedure. And it is very unusual for anyone on the outside to be involved in this process. So this investigator is coming to Anchorage and will be running the investigation. So as I said, he will make use of internal affairs personnel, but he will be responsible for ensuring, final say on what questions are asked in interviews, what the strategy is for investigating, and he will be the one reviewing everything and making the final report.
And I just want to make sure I understand, because we recently heard from the state that their review of the case from a legal standpoint, and this is a separate process. This is an internal review as to whether there was any violation of policy or practice or internal procedure in this particular case, which is a normal procedure that we would go through for any of these things. And this person is being added to that as an external evaluator, and will determine his or her sort of review of that and report to you. Does that all sound correct?
Yeah, and to clarify a little bit more, there are three potential paths, three potential processes that could lead to some kind of action. So one is the criminal investigation process, which the State of Alaska Office of Special Prosecution completed, declined, and that could result theoretically in criminal charges against an officer. So that process has concluded. No criminal charges will be brought. The second layer is what we're talking about now for this external investigation into the incident itself. And this is what is typically an internal personnel disciplinary investigation that looks at, did this officer behave the way that he should have? Did he comply with APD's policies, training, or did he deviate in some way? And if there was deviation, was that deviation justified by the circumstances? So this is an internal, did this officer follow APD's rules? It's a kind of an HR type investigation, I would say. And so that's the one that's being done externally. And the point of the external investigation is really to ensure that in this particular incident, given the high degree of public interest and the questions that the community has had, to ensure that it's not just APD investigating itself, that this investigation, although the results of this one will not become public, is being done properly and objectively by somebody from the outside. And then the third layer is a potential civil suit, from anybody who was involved in the incident. And that's a separate thing. The family has an attorney, and I'm sure he is representing their interest in that one.
Do we have any questions? No? Okay, right. This last piece is that just lost my train of thought. This is going to be internal. Will there be any sort of report out of any type for us in terms or the public from this, or will there be no information shared in terms of what the result of this is?
That one, we may need to see what the results are and see what information is able to be shared. And my direction from the mayor and from APD is to help them share as much information as we legally can. So I think that we'll be looking for ways to share information as long as we're not violating personnel rules and the municipality's ability to share information and APD's ability to share information. But more to come on that.
All right, thanks. And then you were going to report on the second one as well.
So the second outside review is broader, and it is, I would say, more forward-looking and constructive. So its purpose is to review what APD is currently doing. When an officer makes the decision to use force or not use force, what are the inputs that APD has provided to inform that decision and to equip that officer to make that decision? So this review will be a review of APD's policies, practices, procedures, training, tactics, as they relate to use of force and de-escalation. And the outcome of that will be a public report and hopefully recommendations about additional tools that APD could have, additional resources that could be provided, policy changes, if there's a way that APD could do things differently to reduce the need to use force. That is the goal for that. So on that, we are working on an RFP and working with the Chief Equity Officer, Kim Waller, on that to ensure that the scope of the request for proposals is appropriate and really reflects what the community is interested in seeing from this. So we are hoping to get that up soon, and it will follow standard RFP process, which means it will be, it'll be a sealed bid process. Each proposal will be reviewed by a panel of scorers who will each score objectively according to the scoring metrics, and then the best one will be selected.
Okay. And the information from that report will be public, is that right?
Yes.
Wonderful. Any other updates from you?
I can give a prosecution update.
Yeah, that'd be great.
All
Thanks.
right, so prosecution, as I think everyone knows by now, has been critically understaffed for some time. We are, I think, about to turn a corner. We've had 5 new prosecutors join since June and 3 in the month of September alone. Our new prosecutor training specialist, which is a new role in the department, the former municipal prosecutor, Dustin Pearson, began that role on Monday. He's spending all week this week, I think, at APD, working on training with doing some training there, and then he'll come back and bring that and be able to train up our new prosecutors. So his role really represents an investment in ensuring that, recognizing that we often have new attorneys coming through the office, ensuring that we're able to train them, that we're able to prosecute effectively, efficiently, consistently, for now and for years to come. Dennis Wheeler, the new municipal prosecutor, starts on Monday, and so he will be getting that office into shape. Hopefully, it'll take a little while before we start really seeing the results of this, but I think within months, we are going to get there.
Great. And I would invite you to invite him to come to the next meeting if possible. We'd love to meet him and have him here as well.
Absolutely.
Yeah, thanks. That's great. Thank you for time today. Okay, we're moving through quick. We've got a lot to do yet. Is there someone here from the Office of Emergency Management? Wonderful. Come on up. Yeah.
Good afternoon. I just have one update for you in regards to your priorities for this meeting. We have a grant that will be coming to your agenda shortly. It is an annual grant. It funds 4 of the 7 staff that are at the Office of Emergency Management. It funds half of their salary. There's only one person at the Office of Emergency Management that's actually fully funded by the city. So this is a really important grant for us. It is basically the workhorse of how we get emergency management done in Anchorage. It's for strategic planning, incident management training, exercising. The Emergency Operations Center has to be maintained and upgraded on a regular basis in order to keep up with technology, and all sorts of staff need to be trained, and we need to change policies and procedures and have schedules and method for that. So this is a really important grant for us. I'm assuming it'll be non-controversial, but I'm happy to take questions about that. I've already briefed you guys on the other things that are coming from the Office of Emergency Management to your agenda. That includes a wildfire-related mitigation grant that should be in your queue, if not the next meeting, the meeting after that. It's a $400,000-ish grant for risk analysis related to wildfire. I bring that up again because you were asking about wildfire mitigation earlier. And then as well, there is an appropriation that should be on the agenda, I think, for the 8th to finish up earthquake infrastructure recovery from the 2018 earthquake. I'm happy to take questions from you. Again, it's a great opportunity to do that before the next emergency.
Yep, I think we have at least one and maybe 2 other questions. Ms. Rella, you want to start?
Yeah, thanks. Just a question. I know last year we approved, I think it was state funding. It was basically the CDBG DR disaster relief. I know there was a bunch of different projects in there. I just wondered if you have an update on any of those. I know some were granted to the planning department, some were granted to other departments, but just in general, can you remind us what the time frame is for that and what some of the activities are? Thanks.
Sure. So between now and the end of 2026, there's a few projects that we are administering through the Office of Emergency Management. The first project has to do with overseeing planning projects and making sure all the paperwork is filled out. It's a HUD grant, so it requires monthly reporting, and several staff at the municipality are also funded by these grants, so we have to do payroll related to that. But there's also a hazard mitigation grant program that's all hazards. So that's the umbrella program. That is a position at the OEM that is fully funded at the OEM. This is the first ever all hazard mitigation program manager. And he is working on a comprehensive all hazard risk analysis. Right now, he actually is working with a contractor already to have a vulnerability analysis done as well, and consequence analysis done. So that would, right now, the city does a great job of reflecting dollars and how things might be affected by hazards in dollars. But what they don't do a very good job of in our current documents that are planning documents is talking about how it affects people, how it affects responders if we were to have an earthquake or a massive extreme weather event or something like that. So there's different components of vulnerability that need to be properly analyzed for the city. And so that's a project that he's working on right now, and that will move forward to inclusion of human caused hazards, for example, is another place where we could do a little bit more work. So cyber planning, terrorism related events, civil unrest, et cetera, different types of human caused hazards that the city is exposed to. And then as well, our new hazard, which is tsunami, with the new tsunami study that came out last year. So lastly, after doing all that planning and risk analysis, he will come up with a mitigation strategy to significantly reduce or prevent those hazards as he can find ways to do that with our partners. So that's what our staff is doing. The planning department has a couple of projects that they're working on as well. They're working on a citywide seismic analysis and data related to that, data analysis related to that. And then secondarily, they are working on several different types of comprehensive plans and inclusion of hazard mitigation in those comprehensive plans. So for example, the Southside Neighborhood Plan is currently being updated, and they have been talking to us and asking for our technical advice on how the wildfire portion of that might be effectively planned for in terms of hazard mitigation. Sorry if I'm using too much emergency management speak, but.
Just a super quick follow-up, and then just to say, I don't see folks texting, but I would want the discussions about that to make sure that there's a balance between protecting against, for example, putting more housing in areas that do have those hazards, and also recognizing the fact that we're all living in basically a earthquake danger zone, right? If it's big enough, all our houses go. So just making sure that as we're looking at that, because I think it'll be really helpful for planning purposes in terms of where we should be allowing more housing, right? Having more zoning. So I want to make sure that it's balanced and it's not. And I know that's not what your intent is, but to not just say, oh, we should not allow any housing in these areas, or that we should be reducing our housing capacity, if that makes sense. Because I think we have to balance those things, right? Where is it feasible to develop, and then where is it potentially hazardous, but how do we marry those two things? Thanks.
Thanks for your time.
Okay.
Appreciate it. Okay, we have a couple of things. I want to make sure we have time at the end for some audience participation. I know there's some folks here that would like to speak, but before we do that, I want to give some space for a new business, Out of Kids Hands Act, and I believe we have a resolution in front of us to consider. And Ms. Brongo, you're going to speak to this. Is that correct?
Thanks, Chair. This is a draft resolution. Beth Rose and Jenny Loudon from Alaska Eating Disorder Alliance came to the Health Policy Committee meeting last fall and talked with us about the high numbers of eating disorders in youth, Alaskan youth and Anchorage youth, especially after coming out of COVID, and how over-the-counter diet pills and muscle-building supplements play right into the problem. 1 in 5 women and 1 in 10 men state that they use those products. And the dietary supplements, which I was surprised about, are not regulated by the FDA. They're not inspected. They are sold over the counter. And there is, first, no scientific evidence that they're effective in building muscles or weight loss. But diet pills and muscle building supplements are often adulterated, mislabeled, or have unclear dosing on them. The use is associated with higher risks of eating disorders, addiction to anabolic steroid use, and then myocardial infarctions, strokes, severe liver injury, including having to have liver replacements. So this resolution is at the city level, we cannot control diet supplements and muscle building supplements, but we're asking the state leaders to take a role in limiting access of these, especially to youth. And you can read it. I'm still going to be working on it a little bit, but it's going to be introduced well, we're hoping to pass it on the October 22nd assembly meeting.
Thank you. Are there any questions that? You have one. Go ahead. Ms. Rowley?
Yeah, thanks for bringing this. So just to clarify, this is going to basically ask for state action. So it'd be asking our legislature.
Exactly.
Thank you.
I was hoping that we could do something, but I heard that's a lift that the city can't do. So, I think even bigger would be limits to social media algorithms in the body image of our youth. But this is a start to helping with it.
Thanks, Ms. Fraga. I don't see any other questions. So we're going to move along on our agenda. Let's see, I think we'll move into audience participation. I will just give a quick update before we do that, previously we've had discussions about the effort to consider reestablishing the Public Safety Commission and the work to try to align the interest of the community in public safety oversight, particularly citizen oversight over our police department. There is a marrying of those two bodies of work and trying to identify if this new version of the Public Safety Commission, or whatever we would call it, could serve in that role, or at least part of that role. And so there's an ongoing discussion about that now. And as we move along in that planning and that work, I'll continue to give updates at this meeting. So with that, we have some time left for the public. Can we set up a microphone for someone to use?
Mr. Chair, I'm sorry, I had a question on the previous topic.
Yes, go ahead. I didn't see your text. Mr. Constant.
Thanks, I'll be quick. The question is for the resolution regarding asking the state for legislative action. Is it in a position to be shared with the legislative committee? Because that is also a proper committee to review the question, in particular if there's a draft.
Would you like to respond? I think the question was, is it in a position to share with the legislative committee as well?
Yes, it is in a position to share now.
Ms. Rowley?
I would recommend then that it gets on that agenda.
Yeah, and this is, so as chair of that committee, we have our next meeting on Thursday, October 10th. So especially if you have maybe an updated draft, we can definitely make time for it. Otherwise, we're going to be talking about the legislative program. So this fits in. Thanks.
Great, thanks. Okay, and where, right there. Okay, you want him to sit right at the end? Okay, great. All right, would you like to come up? And then we have the clock ready to go. Excellent. So your clock will start up on the screen in front of you. If you could introduce yourself, share your name and what area of town you live in, and you'll have 3 minutes. Thanks. Oh, sorry, can you reset it for 3? Thanks.
Okay. For the record, my name is Mercedes Arciniega. I'm a resident of West Anchorage. It's kind of a shame that APD representation left before I could make these comments, so I hope they get back to them. But I want to specifically address how APD is choosing to release body-worn camera footage to the general public. I understand editing and redacting information for a myriad of reasons: ongoing investigations, safety, privacy, protecting the public from a fraction of the violence that's captured. But they're still getting it wrong when it comes to the transparency component of relationship mending with our community. These critical incident summaries are being told through still a biased lens of choice edits and carefully crafted statements, both of which I know for certain are all designed and strategized tightly with their community relations unit. And that only insulates the department from any criticism, and in fact, only puts more onus onto said suspect or extenuating factors, bystanders, what have you. Anybody but the actual police that is present and held accountable in these summaries. In the awful case of the August 13th incident, which I like to humanize as the death of Easter Leafa, there's an emphasis on her being an imminent threat and being uncooperative, not responding commands. There was an emphasis on the family being uncooperative and interfering. But if we're going to provide commentary for that, then we need to also be providing commentary on police conduct. They all go through officer survival training and de-escalation. They literally do simulations and how to handle these situations. There was a language that was not English being spoken. They know to use their voice as the number one tool in everything, including before they get to non-lethal. Where were the questions? Where was the judgment on why they didn't ask? A language barrier, mental health issues, a pattern of behavior. None of that is in that commentary. And so unless police is willing to do that or not, or if it's for the case of we don't want to open ourselves up to not to critique, police need to just be releasing unedited footage with certain redactions. Thank you.
Thank you. And just for information, we'll make sure that that this is recorded, and we'll make sure that the chief case hears it.
All right, thank you.
Thanks. Next up, we have some time, so you can sit right there, state your name for the record and what area in town you live in, and you'll have 3 minutes.
My name's Quinn Yeager. I live on the south side of town. My question is, where are we at with the public safety and the homeless, like people that are being released from jail and not having anywhere to go or anything like that? Like, where are we at with the resources and the assistance for those individuals that are literally being let out of jail, with nowhere to go, and they're going to these homeless camps, and then they're being in very much so public, that's public safety. So I just want to know where these resources at, where are these people's at besides Partners in Progress, where you have to be on an either active probation or something of that nature. Those people can't even get out of AJ and come down and even they can have the soup kitchen, they get fed, but then they go right to the streets. So where are these people at on the streets to basically not house, but at least give a direction to where, because the brother Francis, you have to be there at 8 o'clock in the morning. What if somebody gets out of court at 2 o'clock? I'm just kind of wondering where those resources at and how we can apply to get some money to get a resource there. Thank you. I appreciate
Thanks.
it.
And thank you for your testimony. Okay. Next up. Okay. Thank you for being here. Please state your name for the record and where in Anchorage you live, and you'll have 3 minutes.
Pastor Adrian Reed Richardson, and I'm gonna try to be succinct. I agree 100% with what the previous speaker said. I wish the police department representation was still here. I have 2-3 comments within the 3 minutes. I was very confused with Chief Case's explanation of the August 13th loss of life of Easter, because in our previous meetings and exactly when it happened, that first 2 weeks, we were assured by the police department and administration that it was going to be transparent and it was going to be an outside investigator. And for this report to come back in barely a month, and it was done eternally, and it says Alaska, the report says Alaska special prosecutor. How can Alaska monitor Alaska? It needs to be totally independent. Now, the Department of Law came back and said there are 2 more reviews coming up, but one of them, she just said, to answer your question, it will not be made public. So that affects our transparency and the confidence that the public has in this process. Number three, another one, she said it was going to be like an internal HR, and then they're going to have best practices done with the Kim Waller and an RFP. We need to restore the safety, the confidence, the heart, and the healing of the city through transparency. I do want to say I appreciate Chief Case's explanations on what they've done since, all those graphs and information. It was very helpful, but I want to know, and he said they add 2 days of additional training. That's good. But for mental health, but where is the cultural awareness? Out of the 7 people that were unlived in the less than a year, out of the 8, 95% are people of color. So where is the cultural training being given to the officers that are going to be policing our streets with their job is to serve and protect? So and his last slide that says a decrease in referrals and 185,000 calls they had from 23 to 24. And then they had referrals, 250, criminal, 46. You take all those numbers that he gave us and apply them forward, that means 15% of those 185,000 calls that they received in that year resulted in something positive other than incarceration or death. Only 15%. That means the rest, the 85%, resulted in negative outcomes of those 185,000 calls. I did the math. So we need to come back to the transparency and the healing that we were promised. I'm not being combative, but we just need to have more training. And I appreciate the efforts they've done so far. But I really want to ask today, can we have the Justice Department or some other outside auditor review the best practices of the Anchorage Police Department? Thank you so much.
Come on up. And how many others who want to speak in the audience? Just want to make sure we have time. Okay, so you'll be the last one. Thank you for being here. State your name for the record and where you live, and you'll have 3 minutes.
Hi, yes. My name is Emily Clock, and I live in Midtown Anchorage. And I do want to speak to something that Adrian just mentioned, which is, as a white person in this community, as a white person in this state, I really encourage that other white people need to be speaking up on this issue. We need to be advocating on this issue. We need to make sure that it is not just a burden that's being carried by people of color in our community. And particularly when it comes to the state level, a few people here talked today about the Office of Special Prosecutions and that they're not pressing any criminal charges against these police officers. So we know there are things on the state level that need to be done. But we have people like Senator Elvie Gray Jackson, one of the few Black women who is a representative on the state level. And she is one of the only people willing to speak on this issue, willing to bring up police accountability bills. So I really want to encourage all the city elected officials as well to make sure you remember on the state level, people need to hear that we care about this issue, that we want things to change. I'm also here today speaking because I work at Native Movement and I serve as the Alaska Coalition for Justice coordinator. And we had a meeting on September 10th that was open to the community. So it was a community conversation. The idea was to have dinner to make sure people could talk, feel connected, not feel alone, because there is so much trauma that people are suffering from, especially seeing camera footage of all the shootings by Anchorage Police Department. And so we all came together. We had about 70 people there, which really shows this was a very needed space. It was a difficult conversation. There were a lot of emotions, a lot of anger, frustration, sadness, and grief, and also beautiful moments of connection and support for people, and particularly families who have been suffering and continue to suffer the consequences of this trauma. But I would say a big point that we heard there was that people are ready for action. While we need to be thoughtful in how we implement police oversight of APD, people are ready for that to happen. We can't do it on a slow time frame. We need to move forward on that. So the calls to action that we heard from community members are independent police oversight with subpoena power. We also heard that there needs to be support for mental health. So in particular, the things like the mobile crisis team. It sounds like APD is also echoing that, saying that sometimes they do not divert calls that way because there's not enough staff support. And triaging calls correctly needs to happen as well to make sure that mental health support is there when it's needed. I know you don't normally respond to questions, but the last point I wanted to make is that people are also interested in how they can advocate for this on the city budget level. So I saw there's public hearings on October 22nd and November 6th, and I'm curious if we know when and where those will be. Thank you.
Thank you for your testimony. And actually at the end, I think I'll have Member Raleigh speak to that.
Thank you.
Thanks. I know we're almost at time. There's two other quick items. I wanted to give a chance for Member Rivera to speak. I think he wanted to speak about the distinguishing between the state and the municipality in terms of the work we're doing to respond to some of these cases. Member Rivera, do you want to speak to that?
Yeah, thank you, Mr. Chair. And I really appreciate the comments that were shared by members of the public. As I was listening to this meeting, I was also a little bit confused about what was exactly going on. But from what I understood, the State of Alaska OSP, Office of Special Prosecutions, did put out their report. And now that OSP's report is done, the municipality is going through their process to do their independent sort of third-party investigation as well. And I think we heard a little bit about that today. What I heard from the municipal attorney was that as much of that report as can legally be shared will hopefully be put out to the public, but that's going to depend on legal construction of what can be shared and what can't be shared. And so my hope, and it sounds like the mayor is aligned with me on this, is that as much as possible of that third-party report is shared with the public as possible. So I look forward to learning more about that in the coming weeks. Thanks.
Thanks. And just yes, the external evaluation of the Easter Leifa case is being done by someone outside of the department and outside of the state, from what I understand. So, and then just on the budget question, Ms. Brawley, do you want to speak to that?
Yeah, thank you. Just very briefly, I believe it's today that the mayor's office and the Office of Management and Budget will be publishing their draft budget. So I know we're all looking forward to seeing that. And then we'll see kind of what the mayor's proposals are. And then of course the assembly will take up amendments and changes to that budget before we vote on it on November 19th at our regular meeting. The two public hearings that Ms. Clock mentioned are at our next regular assembly meetings. So they're part of public hearing items, but we always have two hearings on the budget because it is such an important topic. So anybody who would like to participate in that, please come in person, or you can send emails. The ordinance numbers will be on the agenda at that time that you can refer to, but it is essentially our operating and capital budget. Thank you.
Thanks. And you can also call in, and that's another way to testify. Okay. Do I have any other questions, comments? Go to the order. None. Thank you, everybody, for being here today. We are adjourned.
Oh, I'm sorry. Are you guys going to take any comments over the phone?
Oh, I didn't realize there was someone on the phone.
Yes, you have multiple people on the phone.
I apologize. How many people do we have on the phone? Three. Okay. Yeah. Can I have a motion to extend just for? I think we can do it in 9 minutes if that's okay.
I'll move to extend to 12:40.
Okay. Thanks. So sorry about that, folks on the phone. Okay. Let's have the first person go and state your name for the record, where you live in Anchorage, and you'll have 3 minutes. Who would like to begin?
I'll go ahead and go. My name is Cynthia Gachapine. I live in East Anchorage. So I just have a few things, and I'll make it quick here because most of us are actually at work. Chief Case publicly stated that during this meeting that the MIT had been en route to 2 of the recent officer-involved shootings, specifically the shootings on August 13th and September 29th. He stated that the MIT didn't arrive on scene until after the shootings had occurred. So my question is, why did officers not wait for the MIT to arrive before engaging in these 2 situations? I would think that the officers would be trained to wait until MIT arrives if it's been decided that they're needed. It doesn't seem to matter if an MIT unit is if we have them, if they're not actually utilized when they're clearly needed and called upon. The second thing I have is Chief Case stated that they are tracking gun-related crime. Will this information be available to the public? Because I don't see it available in last year's review that you guys all put out. Chief Case also stated that there is a 40-hour yearly CIP training. So my question for that is it mandatory that all officers attend this training, or is that just something that they can opt into? And lastly, this one is for the Department of Law. When they were talking about the external investigation, which I want to be clear, that is not going to result in any charges for these officers. I think people are kind of confused on how that works. This is for the internal affairs portion. But my question is it going to be made public who they pick to do that investigation? Will we know? I understand some of it was going to be private and some of it was going to be public, but I really think it's important that the community knows who is picked to do the investigation at some point, either in the beginning when they decide who it's going to be or when they publish their report. That's all.
Thank you for your testimony. And just a note, would you mind emailing me those questions? I would really appreciate that so that I can follow up on each one of them. Okay, who would like to go next?
Oh, yes.
Hi, my name's Michael Patterson, and I live in District 5. I'm calling on behalf of the Party for Socialism and Liberation Anchorage. Really, my questions are, well, more like comments regarding the external investigation. What was the procurement process that the municipal attorney used? Who is the actual external investigator? What are their credentials? What do they do? That needs to be public, because I understand that the law and personnel law, like means you can't put a lot of stuff out, but we need to know who's actually doing this investigation so that the public can actually look into who this investigator is. And also, it is very disappointing to hear that this investigator is going to be using internal affairs resources. That doesn't really scream independent. And also, what is also frustrating is that the only shooting that is going to be investigated is one. There have been 8. And I want to also reiterate everything that the LaFrance administration is describing with this external investigator, with the review of policy and procedures. That is what independent police review boards do. So is the LaFrance administration proposing essentially that only the most controversial shooting will be investigated by a third party? You know, where he said that the Office of Special Prosecution ensures that APD collects all the evidence. That is not a true statement. That's a lie. And I also want to mention on October 20th, which is a Sunday, at the LUSAC Library, there will be another community conversation where we will actually start the process of developing a community model for an independent police review board. Because if you're having conversations about the Public Safety Advisory Commission, who is having these conversations? Is you having this conversation? Is LaFrance administration having this conversation? Where is the public input into this process? So you guys are making the same mistakes people did with the body cameras. Please learn from that mistake. That was not a public process. Please actually have a public process, because we have 8 shootings now, 5 people have been killed, and really the approach the city is taking is very lackluster. It's very mediocre, and there are resources out there at the national level and here locally that are ready to do this work. The city just needs to stop trying to pretend like those resources are not there. Thank you.
Thank you for your testimony. I heard there was one additional person. Would you like to speak now? Share your name for the record and where you live. You'll have 3 minutes. Nope. Okay. Anybody else on the phone? Nope. Okay. Thank you, everybody. I appreciate you being here today. We are adjourned.